Dr. Paul here. I've got a baby with what I think you're going to be interested in learning about, inguinal hernia. Let's go take a look. Hello. Hey, how you guys doing? Yeah. All right. So, get some gloves on here. Hi, buddy. How you doing? Hi. Oh, you looking at the camera? You know it's time to put on your smile. You're too little to give me a smile, aren't you? All right. So we've got a little inguinal hernia on this side. We're gonna make sure we don't expose your parts. So there's this bulge. That's a big bulge right above where the scrotum's down here, and loops of intestine go through a little defect in the abdominal wall, and you've got a loop of intestine that's actually out of the abdomen and bulging up right here down next to the scrotum. So I'll show you the other side for comparison, and you'll see there's no bulge. So you see that difference? That's his. We're protecting his manhood for the sake of being discreet, but there's the difference. I mean, that is a huge bulge, and when you feel this, it is squishy. It's a squishy bulge. So what we do to, if sometimes the loop of intestine will actually get trapped outside of the abdomen, and that becomes an emergency. And doctors who know what they're doing, and parents can actually learn to do this. If you have this happen, you gently push back and forth. And normally what I would be doing is with my other hand, I would be cradling the testicle so that I'm not pushing hard on his testicle. So this hand would be cradling the testicle and protecting it. And then this hand is going to gently massage until that loop, those loops of intestine go back into the abdomen. And sometimes if it's really firm, it can be uncomfortable. And you can, I don't know if you can tell, but it just squished away. So it's momentarily, right this second, it's gone. Now he's going to cry and it's going to come right back because he's got a defect that I can actually put my finger into the hernia, right there. There's actually a hole in the abdominal wall the size of my little finger. We just can push that, squish that all back, and it's gone. So that, folks, that's a normal side, same as this side. And then if he screams, it's going to come right back out because it's such a big defect, the loop goes right out. That's an inguinal hernia. So an inguinal hernia of this size will not close on its own. Sometimes, very rarely, oh here, I'm not going to leave you all alone. Can't leave you all alone. Sometimes, very rarely, a little inguinal hernia will just close on its own, so it can be watched. It's not an emergency as long as it's not stuck and it's out. But one this size, he actually has a small one on the left side and this large defect on the right, will need to be surgically closed. Usually that's going to either be a pediatric urologist or a pediatric surgeon. And they like to do it when the kid's at least 10 pounds. When it's not an emergency like this, they'll usually wait till you're 6 months or perhaps even later. Sometimes they'll do it sooner, but at least 2 months. And it's just a minor little surgery. They just make a tiny little incision and sew up that defect. You've got the abdominal wall has a little hole in it, and they just sew it up. Piece of cake. There'll be a minimal, if noticeable, scar whatsoever. There you have it, folks, an inguinal hernia in a baby. And, of course, you know, those of you who have gone to your sports physicals, teenagers and young adults, the doctors are always telling you to turn your head and cough. That's what they're checking for, is that little defect in the abdominal wall. Because athletes, especially if you're in football or you're doing major strain and lifting, you can force a loop of bowel through an abdominal defect. That's the inguinal hernia. So anyway, thanks for watching, folks. I'm Dr. Paul. Big thumbs up for this guy. Yeah. He's like, I'm chill. I got this. I got this. All right. Thank you for letting us do that.
Yeah, thank you for letting us go.
That's very educational. I think that's the first inguinal hernia we've had, and to actually be able to see it.
Second one in 5 years.
Yeah.
Second one in 5 years.
Nice.